welcome to Askimo TV. I'm talking today to Dr. Jake Sloane. Dr. Sloane is a surgical registrar and trained aesthetics doctor. Hi, Dr. Sloane, how are you?
Hi, good morning, Joanne. I'm fine, thank you, and thanks for inviting me to interview today.
Pleasure. Dr. Sloane, today we're going to be talking about minimally invasive procedures to restore youth to your face, and in particular about dermal fillers. So let's start off with what are dermal fillers?
So dermal fillers are, in contrast to botulinum toxin, used to treat static lines of the face or create volume to areas of the face. So, for example, a common use of a dermal filler would be to improve the so-called smile lines around the corners of the nose and the mouth. Used in a volumizing capacity, they can be used in areas such as the cheek to create volume of the cheek area to support the upper face and to improve the lines by supporting the skin above it. They all modern fillers, should I say, contain a molecule called hyaluronic acid. This is a naturally occurring substance that we find in our own skin, so the chance of any allergic reaction is very small, in contrast to what used to be used in fillers, which was collagen and silicone, which are not used anymore because of their known side effects.
Who would be an ideal candidate for dermal fillers?
So dermal fillers can be used in different areas of the face. So depending on what the patient wants, their age bracket may sort of define the effect. For example, in a younger patient, lip filling and pout treatment tends to be more of a popular procedure. Whereas in middle-aged to more older patients, where lines, as I mentioned, around the mouth and the smile lines, and also in the frown area as well, where very pronounced lines that botulinum toxin treatments won't be sufficient for, they can be used to create the illusion of filling in these lines.
Talk me through the procedure and what a patient can expect to happen.
So, just like with botulinum toxin treatments, a patient would typically have an in-detailed medical consultation prior to the procedure. We would talk about, firstly, their medical background, any previous treatments that they've had, particularly to the face. We would want to know if they're taking any regular medicines. Some medicines may contraindicate the procedure, and any allergies as well. Then we would move on to looking at what the patient hopes to achieve from the procedure and whether they have realistic expectations. Assuming all these criteria are met and the patient is happy, then we can move on to the treatment.
So tell me exactly what happens in the treatment.
So I'll take the smile lines, or the so-called nasolabial folds, as an example. A patient would typically spend approximately half an hour, maybe 40 minutes, throughout the whole consultation, from the history taking through to the end of the procedure. After the medical background and history has been taken, the patient would be made comfortable, and often we would use a local anesthetic cream on the skin to numb the skin. There are newer products available which actually contain a local anesthetic within the filler itself, and depending on the practice of the doctor, some people would be comfortable with injecting without an extra topical local anesthetic as well. In my own practice, I always use the cream because I prefer the patient to be as comfortable as possible. The cream typically takes about 15 to 20 minutes to take an effect, where it's wiped off, and then the line can be filled using a needle technique. The syringe comes with a pre-filled filler, and this is injected in serial injections to fill the line to completeness, and then obviously the opposite side is done as well.
What should or shouldn't people do after the procedure?
So for a dermal filler procedure, patients are advised to, if they can, advise to not touch the face or massage the face. It's always useful for the product to sit and take for a good 24 hours or so. Very occasionally, I advise patients if they perceive a small lump or grainy type sensation under the skin, I show them how to massage this. This isn't that common, but sometimes it's useful. Patients should be advised to not undergo any procedures such as dermabrasion of the face or have any medical procedures such as facial treatments. They should let the skin relax for the next few days or so. They should also avoid extremes of temperatures such as having a sauna or a steam bath, something like that, because that may also affect how the filler takes under the skin.
How long will the effects last, and how often will I need to do the treatment?
So, depending on where the filler is injected, the time span of the filler is variable. For example, the lips, where much more movement is used, the filler tends to last a little bit shorter, so up to around 6 months is typical. Filling in areas such as the lines of around the mouth, the nasolabial lines, these lines can typically be improved for up to 12 months. And in fact, some patients return to me to say that whilst the filler has probably now dissolved and gone, the overall appearance is better than it was prior to the treatment. There are other fillers where we use to create volume, for example, the cheeks, and these areas can last for even longer, maybe up to 18 months.
Thank you, Dr. Sloane. Thank you so much for talking to me today.
That's a pleasure.